Welcome to The Explainer. Today, we're doing a deep dive into Dr. Gabor Maté's really revolutionary way of looking at trauma. And if you're a mental health professional in training, stick around, because this could totally reshape how you see addiction, healing, and honestly, the very root of human suffering. So, let's just jump right in with a question that gets to the absolute heart of it. Is trauma the terrible thing that happened to you, or is it the wound that now lives inside of you? For Dr. Maté, just getting this one distinction right is maybe the most important step towards any real healing. Okay, so here's our game plan. We're going to walk through Dr. Maté's core ideas. We'll start by redefining trauma as this internal separation. Then we'll look at how that split shows up as either extreme sensitivity or this kind of emotional armor. After that, we'll reframe addiction completely, not as a failure, but as a survival strategy. And finally, we'll explore what healing really is, finding our way back to our true, authentic self. All right, let's get into that first big idea. Maté basically argues that we've been looking at trauma all wrong. It's not about the event that happened out there. It's about the internal wound, the separation that happens deep inside of us. You know, the word trauma itself actually comes from the Greek word for wound, and Dr. Maté really leans into that. He says the wound isn't the car crash or the bad thing that happened. The wound is the disconnection from ourselves that happened because of it, a split from our real emotions, from our gut feelings. This quote just nails it. It's the core of his whole paradigm shift. Think about it for a second. If trauma was just an event that happened 20 years ago, it would be over, done, sealed in the past, right? But if the trauma is the internal wound that we're still carrying around today, well then guess what? It's accessible. It can be healed right here, right now. And here's what's so crucial to get. This disconnection, this separation from self, it wasn't a mistake or a weakness. No way. For a little kid facing something totally overwhelming, shutting down and disconnecting was actually a brilliant survival strategy. The mind literally had to split from itself just to endure what felt unendurable. Okay, so now let's explore the two main ways that these unhealed wounds tend to show up. You know, both in the clients I've worked with and, let's be honest, often in ourselves too. So every unhealed wound tends to look like one of two things. On the one hand, you have this sensitive wound. It's raw, it's open, and it hurts like hell whenever anything touches it. Then on the other hand, you have the hardened wound. This one's covered in thick scar tissue, it's become rigid, inflexible, and numb, a place where feelings have just been shut down in order to survive. And if you want to see some data that really puts this into perspective, just look at the Adverse Childhood Experiences Study, or ACEs. This research tracks things like abuse, neglect, and family dysfunction. The results are just staggering. A male child with 6 or more of these ACEs has a 4,600% increased risk of becoming an injection drug user. No, that's not a typo, 4,600%. So what does this actually look like in real life? Well, someone with a sensitive wound might be completely devastated by a tiny social rejection. From the outside, their reaction might seem way over the top. But for them, that small thing that just happened is pressing directly on that raw, unhealed wound from their childhood. But that very same high ACE score can also create a hardened wound. And this person often looks super successful. They're the workaholic, the overachiever, the leader who never shows any vulnerability. Society rewards these traits, but so often they're being driven by this deep internal emptiness and need to constantly compensate for that original pain. This brings us to one of the most misunderstood results of trauma: addiction. In Maté's view, addiction isn't some disease or a moral failing. It's actually a tragically logical attempt to cope with the unbearable pain of that internal separation. Check out Dr. Maté's definition of addiction here. It's incredibly broad. Notice what it doesn't say? Anything about drugs or substances. It's any behavior you crave for short-term relief, but that causes you long-term harm and you just can't seem to stop. This applies to work, the internet, shopping, gambling, just as much as it does to heroin. So you can see the chain of events here, right? It all starts with pain. That pain leads to separation from the self. Then the addictive behavior shows up as a desperate but totally understandable way to try and soothe the pain of that disconnection. And just like that, the whole clinical question gets flipped. We stop asking why the addiction, and we start asking why the pain. And Maté takes his logic even further. He argues it's not just addiction. Most mental health diagnoses, and even a lot of physical illnesses like autoimmune diseases, they aren't just random bad luck. They're often complex, long-term coping mechanisms, the body's desperate way of trying to manage the stress of that original unhealed trauma. So, if the fundamental wound of trauma is a separation from ourselves, then it just makes sense that the path to healing has to be a process of reconnection. So what's the biggest thing standing in the way of this reconnection? It's shame. We carry so much shame, not just about what happened to us, but shame about the very coping tools we developed to survive, like our addictions or depression. That shame keeps us alone, and it just makes the wound deeper. And this is exactly why healing just can't happen in isolation. It absolutely requires a compassionate connection with another human being. It could be a therapist, a group, a community. That safe, non-judgmental presence is the only thing that creates enough safety for someone to finally turn and face their own truth without being totally overwhelmed by it. So the goal of therapy isn't to get stuck digging around in the past forever. The past is only useful because it helps us understand how those old wounds, those old beliefs, and those automatic reactions are getting triggered and messing up your life right now. The actual work of healing can only ever happen in the present moment. So what's the end game here? What are we actually moving towards with all this work? It's all about reconnecting with that authentic self. So let's take a look at what that journey of, coming home to ourselves really looks like. Look, this is not some big, sudden, aha, I'm healed moment. It's a gradual, lifelong process of slowly letting go of that false personality we built to be accepted, to survive. And that journey is made possible by relationships that actually see and celebrate the real you, and often by things like yoga or meditation that help us get back in touch with our own bodies. Ultimately, Dr. Maté's framework isn't just another theory to file away. It's really an invitation to fundamentally shift how we approach our work, to move beyond just managing symptoms, and instead to learn how to listen with real compassion for the story of the original wound that's just asking to be heard.